working for WHO for 25 years, and the changes in global mental health are amazing, hard to synthesize. Right now, we have a lot of organizations that are realizing how mental health is important. So they are committed, engaged in promoting change in order to make sure that anyone, no matter where they live, finds an answer to the needs that their mental health challenges present.
Mental health is always thought of as an afterthought, that, you have funding available, you're going to focus on this particular program, and if you have a little bit left, you put into mental health. We need to change that narrative.
So this meeting is going to encourage countries to come up with clear roadmaps for what needs to be done to meet the 2030 targets within the region.
At the back of your folders is another reminder about what our targets are. So we keep talking about these 2030 targets. What are they? The roadmap. What is it that we want to do? The 2022 regional framework illustrates it very well. Those 4 to 6 targets are achievable.
We're encouraging countries to identify a few key priorities that can be pushed forward in the next 4.5 years. We will then be supporting countries technically to implement these plans, and we'll also then be working with partners to be able to come alongside our ministries of health to meet the targets and to encourage strengthening of our mental health systems.
Forums like this Mental Health Intercountry Learning Meeting is very important because it brings countries together to learn from each other, lessons learned, best practices. It helps the countries to develop their capacity, and this learning helps us to align our various policies into the global and the regional frameworks in WHO, such as the Global Action Plan for Mental Health.
Investing in mental health is incredibly important because of the scale and the size of the need, but also the opportunity for changing people's lives. And we know a lot about what works, we know what some of the barriers are, and now we need more investment to make that change.
As you all know, mental health care is a Cinderella of the healthcare system, which means when budgets become mean, when we go through austerity, they are the last ones in the queue. We're trying our best to uplift them. And we have tried, because of shortages of staff, to train as many mental health care nurses as possible. Because South Africa has got only 850 psychiatrists for a population of more than 65 million people. And 80% of those psychiatrists are in the private sector, taking care of only 14% of our population. That's why we're training lots and lots of nurse practitioners for mental health. We have also tried to train a number of traditional healers.
The main lesson I've learned, which I'd like to share, is that any provision of mental health care service should be contextualized. In doing so, we are able to address the different social determinants of health.
What is special about us that we train specialists here. We train psychiatrists, we train specialized nurses that are placed from the universities in our area. We've got a lot to offer to other African countries in that we have managed to structure the mental health care services very well, such that at least we can then be able to categorize our patients accordingly. We have established very good working relationship with the primary health care, mental health care services.
These forums help us to accelerate progress to achieve the main targets for mental health. And once we come together to accelerate progress, it helps countries to learn innovations from one another and also help countries to come up with innovative strategies to be able to achieve these targets.
Rwanda has two particularities. One is a country in Africa that has a high burden of mental health problems. The historical background, it's a country that faced the genocide against Tutsi, and this led profound trauma and mental health consequences. And two, in the last 3 decades, it's a country that tried to put in place systems of care, policies, institutions, to alleviate this burden in a country that have limited resources.
But what's the next step? What is that you think you can actually do to move this agenda forward?
The 7th Global Ministerial Mental Health Summit is a very important event. For the first time, it opportunities coming to Africa and to Rwanda. Rwanda is very proud to host the event.
It is reconforting how much progress we have made globally. It's amazing. In 40 years, so much has changed, but a lot still needs to change. Let's continue this work with urgency, with commitment, and with decision. And I'm sure that much sooner than that, we will see way more changes in the world. Thank you.